Hi, my name is Dr. Daniel Babbel. I'm an orthopedic surgeon with a subspecialty in hand surgery and upper extremity surgery. I've been here in Odessa for approximately 2 years, and this is Ask a Doc. So the first question today is, what conditions do you treat? So in general, I treat conditions related to the hand, wrist, and elbow, but I also take care of trauma problems that come in through the ER, such as broken femurs, tibias, ankles. But what I love are problems that get to all of us as we use our hands, wrists, elbows throughout our lives. They wear out, they get sore, they get tired, and we try to make you better. What age ranges do you see? Basically from birth on up until you're not able to come in anymore. Problems with arms and hands can affect anybody at any age. So if you're breathing oxygen, you're within our criteria to take care of you. Third question is, what is the most common cause of wrist pain? That's a difficult one because there are so many conditions. I would say in an older population, it's arthritis. As we use our joints throughout our lives, we wear them out, so arthritis is probably the most common cause. However, there's lots of tendinitis that can occur with the many tendons that cross our wrist that can cause wrist pain. Many of you will also probably heard of carpal tunnel. Carpal tunnel can also cause some wrist pain, although that will also be associated with some numbness and tingling in the fingers. Next question, how do I know if my wrist pain is serious? I tell people all the time that only you know how bad your pain is. I mean, I can kind of judge and help you know what's going on and come up with solutions, but only the patient knows how bad pain is, and only you will know to what degree you need to have it treated. So as you come in, we'll talk about what's going on, how bad it affects you, and I'll give you options. And then it's up to you as a patient to tell me how bad it hurts and how far you want to go with treatments. How long does it take for a broken arm to heal in adults and in children? So typically I tell people a bone takes about 6 weeks to heal. In children, depending on the fracture, it can go a little bit quicker. In adults, depending on how old or what other medical conditions are present, such as diabetes, osteoporosis, sometimes it'll take a little bit longer, up to 8 to 10 weeks, depending on, again, on your age and medical conditions that may be going on at the same time. How do I know if I have arthritis or something else? Well, that's why you come see me. That can be a tough one because, like I said, there's a lot of conditions that can cause pain in the fingers, the wrist, the elbow. So as you come in, we'll talk about it. I'll kind of press on your joints, ask you a lot of questions, and then get x-rays so I can help you know if it's arthritis or if there's something else going on that we need to treat and make better. How do I know if I have carpal tunnel syndrome, and what are treatment options? So carpal tunnel syndrome is a condition where a nerve at your wrist gets pinched. It causes numbness and tingling in your fingers, usually these 3 fingers. Almost never will it involve your pinky. So if you're finding these 3 or 4 fingers are going numb, especially with activities such as driving, doing your hair, talking on a phone, and very often at night, then you probably have carpal tunnel. Depending on how bad it is, treatment options range from as easy as wearing a brace at night and taking some anti-inflammatories, to the next step, which would be trying an injection of steroids into your carpal tunnel, and finally an in-office procedure where we open up that carpal tunnel to take pressure off the nerve. But again, that will come as you talk with me and we decide how bad is it, how much is it affecting you, and how far do you want to go in taking care of it. What is trigger finger and how common is it? Trigger finger is a tendinitis where your tendon gets swollen and it causes your finger as you flex to get stuck. And you can't open it up without clicking or sometimes having to force it yourself into a straight position. And it's painful in the palm of your hand down here. The treatments for that are similar to carpal tunnel. Anti-inflammatories, maybe a shot, and maybe surgery if it's not getting better. What are other more complex problems and procedures that you treat? Wow, that's a tough question because there are so many problems that can arise in the hand, the wrist, the elbow. Some of the more complex ones have to do with rheumatoid arthritis, where the joints have been destroyed because of that condition. The fractures can be very difficult to treat. But one of the joys that come with those procedures are that we can make people better. We can help alleviate some of the pain and disability that's going on because of them. Again, there are so many different problems, it's hard to put it into a category of what's the most complex. But if you feel like you've got something that's going on that you just can't function, it's affecting your daily activities, you can't enjoy the things you used to enjoy, then you should come in so we can talk about it and see if we can make you better.